Today we have Dr. Mohammed Umeer Khan, Specialist Family Medicine, Ahalia Hospital, Hamdan, to discuss about what is D-dimer test and when should this test be done.
D-dimer test, also known as fragmented D-dimer or cross-linked fiber degradation product. So this test is done in any patient who has abnormal clotting mechanism. So in patients like deep vein thrombosis, we do this test routinely. So what is D-dimer? Whenever there is any injury to any blood vessel like artery or vein, there is bleeding that starts occurring. In order to stop bleeding, there is coagulation cascade that sets in and the bleeding is stopped, and again there is dissolution of the clot which occurs normally. If there is any significant amount of thrombus formation, that is the clotting has occurred. But in cases of medical conditions like DVT, there can be increased amount of clotting and dissolution causing a high or elevated D-dimer test. So a positive D-dimer test means that there has been a significant amount of thrombus formation or abnormal clotting mechanism that has occurred in the body. So who do we do the D-dimer test in? Any patient who has an abnormal clotting mechanism in the body like deep vein thrombosis, or those who are on anticoagulation treatment, or those who have DIC or suspected of pulmonary embolism or stroke. So in case if there is any patient who is having DVT, which is an condition wherein there is abnormal clotting in the body again, which can be anywhere in the lower limbs, eyes, arms, brain, or other conditions. So in these conditions, if you feel there is any patient who has had swelling of the lower limbs or pain or any warmthness after prolonged immobilization, or if there is a prolonged journey that the patient has taken, or if the patient is on hormone replacement therapy, or if the patient has had previous venous thromboembolism condition, in any such patient, they need to do the D-dimer test and to rule out deep vein thrombosis. So a negative D-dimer test is very valid and useful to rule out DVT. However, if there is positive D-dimer test, you still need to rule out deep vein thrombosis by doing other medical investigations like Doppler, CT angiography, ventilation perfusion scan, and so on. You should also know that there are some conditions wherein the D-dimer can still be positive without significant thrombus formation. Conditions like malignancy, pregnancy, those who have had recent surgeries or major trauma or infection or liver or kidney diseases, they can have high D-dimer test. If you have any such medical condition, seek medical help here at Ahalia Hospital, Hamdan branch. Thank you.